Well, during these challenging times, just was looking to tell a quick story about a dog, our dog, who passed away unfortunately 3 years ago, Jake, a Nova Scotia duck-tolling retriever, which underscores one, the health benefits of having a dog, and two, the outstanding work of a couple of veterinarians that made a huge difference in the care of Jake over the course of his life. So first and foremost, the health benefits of having a dog. There's no doubt through clinical studies, they really underscore the fact that dogs do provide an outstanding health benefit to people when it comes to fitness, being active, losing weight, and things of that nature. At the same time, by virtue of having a dog, you need to get out and get moving and interact with people from a socialization standpoint. So no matter what your personality is, good social benefits to having a dog. Further that, stress reduction and staving off depression. When you have to be active and you're more focused on the external and something else other than yourself and taking care of something else and being out in nature and all those kinds of things, there's some really great mental health benefits to having a dog. So clearly some great benefits to having a dog. And in my case, Jake was a really outstanding Nova Scotia duck-tolling retriever. He passed away about 3 years ago, but unfortunately, a really, really great companion, family member, if you will, all those kinds of things. Always wanted to be with you wherever you were or wherever you're going, and all those kinds of things. And so, unfortunately, when Jake was about two-ish, he lived around 10. Unfortunately, he started developing some seizures. And as many of you know, it's better to watch and wait to see how frequent those seizures were going to be before basically prescribing anti-seizure medication, which once you start, you've got to use it lifelong. So we were in watch and wait mode, and we had some great support from Dr. Kenneth Barnsley, University of Pennsylvania grad at Kennett Square Veterinary Hospital as far as his day-to-day care. And so he's under observation for those kinds of things over a period of time, which was great, and it was the right move to just watch and wait. That said, Jake one day did have a really bad seizure down in the basement, and we brought him to Dr. Barnsley. He was limping and all those kinds of things, and they had him under observation for the seizure as well as all this thrashing. And basically, after having him under observation for a couple of days, he thought he was getting a little bit better, but still had a pretty good limp to him. So Dr. Barnsley moved forward with further x-rays and noted that essentially, just like a Lego or you have the shoulder, you have a ball and socket type of scenario to the leg, the front right leg, that unfortunately congenitally it wasn't the perfect ball and socket. It was just more congenitally not developed and flat, such that while the dog is very athletic and had some great congenital, some great collateral, if you will, muscles, unfortunately that huge thrashing for a long period of time really uncovered this underlying congenital situation as far as the shoulder. So with that, it was clear that Jake was going to be having some real trouble, because it's one thing to do ACL surgery, which is surgery on the back legs and things of that nature. But when you're talking about shoulders, that's a whole nother thing because of the need of bearing weight and activity and those kinds of things. So through a lot of different conversations, we came across Dr. Sherman, Canapp. He's in Veterinary Orthopedic medicine group down in Annapolis, Junction, Maryland. And when you're in one of these situations when you have a dog and you're really close to them, it's really a bad situation. So we went down to see Dr. Canapp, and the long story short, Dr. Canapp, who did a 3-year residency in small animals and was the founder of Veterinary Orthopedic Medicine group down in Maryland, he did the training down in University of Florida. He came into the room and did a quick consult and noted that, it was a really tough situation, but he was a real confident surgeon. And basically he ended up he said to us, well, look, I can do this surgery, but there's gonna be some pretty amazing rehab to it. And as it turned out, one, he was a phenomenal surgeon and still is, obviously. He's still in practice. I haven't been in touch with him down in Maryland. But basically he did this surgery where it turned dog Jake upside down and did this shoulder surgery, and even did 2 rounds of stem cells over the course of his treatment. One which was acute, and then a couple months later doing stem cell treatments to nourish and rehabilitate the shoulder. But the bottom line is that after that surgery, he was under the care of Veterinary Orthopedic Medicine group down in Annapolis, Junction, Maryland, for about 3 days or so, and then we brought him home. In between that time, he was fitted, if you can believe it, with a vest. So imagine, again, back to the fact that shoulders are weight bearing, here you have this vest that they custom designed so that the dog would be able to only extend like this, that's it, and no bending. So for a period of time, Jake was in a crate for 24 hours a day, and you had to take him out to go. You'd feed him in the crate, and then you'd take him out to go twice a day. That's it. And then from there, slowly, what you would do is, given the fact that one, you want to mobilize, the next step was, okay, now let's slowly get some activity moving. And still, with being in a crate for what seemed like a total of 2 months' time, of that 24 hours, a couple weeks or 3 weeks for sure, we're totally immobilized, not going anywhere, and carrying him out, to where then thereafter, still being in the crate, being in this vest. And then imagine 2 times a day, aside from getting him out, you had to take this vest apart and then do some isometrics to rehab the dog. So morning and night, take the vest off, work on these ranges of motion, if you will, ever so slightly and lightly, not to disrupt the shoulder, and let it heal to be able to go from there. So then after about 2 months period of that time, finally and slowly, once he started getting a little bit of mobility, the healing of the shoulder, he ended up going to get nearby water treadmill, where they got on a treadmill with a tub, and slowly got his walking back. So at the age of 3, clearly Dr. Barnsley, in his practice here in Kennett Square, at the Kennett Square Veterinary Hospital, made a huge difference for Jake, as well as in the end, tell you what, Dr. Sherman, Canapp, when you're looking down, the options or lack thereof, and really the amazing surgery that he was able to execute, really extended Jake's life for another 7 years. So huge difference there. Nothing like a dog. We'll see what happens in the future. As of right now, we have 2 cats, but really a great difference that dogs can have in your life, as well as certainly the practitioners that make a great difference in their lives every day.